Hello, this is Eric Ruderman from Northwestern in Chicago, and I am here with Room Now at ACR Convergence 2021, day 3 of the main meeting. This is another perspective in psoriatic arthritis, and I thought I would talk today about an abstract that, while negative, is likely to get a lot of interest. I don't know about anybody else watching this, but Illinois is a medical use marijuana state and also has adult recreational use. And I can't go a day in clinic without several patients asking me about whether they should use marijuana or CBD or something along those lines. It's kind of the new glucosamine chondroitin, frankly. And so the abstract that really caught my attention was a presentation today. Oh shoot, I have the abstract number in front of me in a second, and now I am losing it. Abstract is, 1456. Cannabidiol as an add-on analgesic therapy for patients with hand OA and psoriatic arthritis. So not specifically psoriatic arthritis, but they included patients who had either osteoarthritis of the hand or psoriatic arthritis of the hand that was not active. So this was really a pain study. They had just about 140 patients or so, and they were randomized to daily CBD. It was a sort of synthetic CBD tablet versus placebo for 12 weeks. The primary endpoint was pain reduction at 12 weeks, and surprise, nothing. The cannabidiol led to no greater improvement than placebo, with about 20% in each group getting some reduction in pain intensity and about 50% reduction in pain in about a quarter of the patients in each group, whether CBD or placebo. They looked at a variety of secondary endpoints, PROs and depression and other things, and none of those were improved as well. It was pretty clearly a negative study. Now, the authors commented that perhaps this was because they didn't use the right dose, or there may have been other medications on board that may have abrogated any effect of CBD, but you can't really get away from the fact that there was literally no response at all. This is an important question, and negative or not, I don't know that this is going to change what happens with the patients, and I'm trying to figure out how I deal with this in my practice. I get people ask me about this all the time. And it's now, based on this, a bit like what we've always done with supplements or nutraceuticals, where you say, well, I'm not sure it's going to help, but it's not likely to hurt you. And the CBD is pretty benign in most of the studies where it's been looked at, but there's a cost to it. And is it worth spending the money? And I think looking at this, even though I've told people before, go ahead and try. And when I tell them that I'll sign off on a medical marijuana card, I always say, make sure you get the stuff that has more CBD, because that's the ingredient that's been associated with pain control. Now I can say, I don't know. And it may not be worth the money. It may be worth it if they're sort of motivated to try it for a few weeks and see what happens. But I don't think longstanding will respond. Now, I think the important thing also to consider is placebo response. And one of the things this study shows is that it's really important to have a placebo group in a study. There's a huge placebo response in OA. There's a huge placebo response in pain studies. And without that, you might have said, well, some patients did better, but seeing the placebo tells you it's not the drug, it's just the act of being in the study. Finally, I want to close. There was another abstract presented today that sort of shed some light on this, or is at least relevant to this. And that is, I'm trying to get the abstract number for you. I didn't have it pulled up. I apologize. Abstract number 1777. And this is from the Forward Registry, from the National Data Bank of Rheumatic Diseases. And really the highlight of this was the large number of patients with psoriatic arthritis who are taking opioids. Over 20% of patients in their registry were taking opioids for psoriatic arthritis, which highlights the important need for something to control pain in these patients. And would have hoped that CBD might have been a more benign way to do this. Doesn't seem to be. We'll see how it goes and whether anybody continues to look at this. For more information, stay tuned to Room Now during the Convergence meeting this year. And thanks for listening.